Okay, so welcome to session number 3 for eICS exercise prep for the May 11th exercise. And what we're going to do today is we're going to spend an hour going through how to log into eICS and how to get your facility highlighted and get yourself assigned into your facility. So it's really important to know how to do this. This is how we're going to communicate during crisis, and it's definitely going to be how we communicate during the exercise coming up next week. So the first thing that you'll want to do is what you're looking at on the screen is the actual login page for eICS. So up over here in the address bar, you could easily just grab this whole address and move it over to your desktop. And that way you'll always have the access right on your desktop to log into eICS. But the login is eics.juvare.com/web/login, and it'll bring you to your page. I have mine pre-set up to memorize my username and password. So I'm going to go ahead and log in and show you where you land. So this is the event landing page. And as you can see, there are a number of events that have been activated, that have not been shut down and or are still in use. Now, personally, you may or may not see this many events. I am a statewide admin, as is Kevin Schlosser. So when we log in, we see everything that's going on across the state. And so what you're going to be looking for is the event that when you get the phone call, it's going to say SDHCC command has activated for the eICS training zone or is activated an incident. So you really need to kind of just look for the coalition command. So one of the things that has happened over the last 24 hours is we have renamed the domain from SD Interregional to SDHCC command. And the reason we did that is because of the changes that are occurring with the coalition, and we are a 501c3 now, and we do have our own command center. So we have changed with the times, and our eICS account is now known as SDHCC command. So look for SDHCC command on the landing page and then click the view button. And what's going to happen there is it's going to bring you into the event. All right. And this is the landing page for the event. So I'm going to kind of introduce you to the landing page a little bit. Over on the left-hand side, it should have your name over there if you're logged in, and it should have your status. So over here, the first thing that you're going to do is notice that it's showing that I'm immediate and I'm on site at the command center. And on site means for you that you are located at your facility in your facility's command center. Okay, and then just kind of check contact info and make sure that your phone number and email address is appropriate. And if there's any changes that you need to make, you can click over here on update status, and it will give you an opportunity to change your availability and your location. You also have an opportunity to put a new phone number in if that's not your phone number. My info is okay, so I'm going to leave it alone. Then you move over to the middle of the screen, and the middle of the screen is going to tell you what type of event it is, when it was started, who started the event, and the operational period. It'll also give you a link to the WebEx, and that's really important because not only do we communicate during using eICS, we actually run a WebEx as well. So this is the WebEx address that you will use, and the best way to do it, Juvare doesn't allow us to put live links in there. So basically you'll just copy it and paste it into your browser, into another page in your browser, and that'll bring you to the Zoom link that'll get you into the WebEx. Okay, and a lot of times in a real event, we'll have some information down here to tell you why we're activating you. So that's important as well. So that's where you kind of figure out, is my communications information accurate? How do I get into the WebEx, and what's going on is in the middle. And then on the right side of this landing page is a couple of buttons. I would like you to completely ignore those buttons at all times, because we get a lot of accidental incident ending or edits or escalations. These are admin buttons only for the people who are launching it. So for us, those buttons would be used by SDHCC command, but most of you have access to see those. A lot of times people will leave the incident thinking that they're doing the right thing by ending incident, which they believe means I'm leaving, but that actually shuts down the entire incident. So if you're going to leave for whatever reason, just close out the browser page, and that's fine. And then you'll be gone. If you hit end incident, you will end the incident for everybody, effectively cutting off communication statewide using eICS. So we don't want you to do that. And then the bottom of the screen has the scroller, which basically tells you that there's activity going on. So right now the scroll is kind of dormant. In a real event, you'll see that thing kind of whipping by as people are logging in and so on. And we will go ahead and show you how to do all of these things. But these are just kind of information. And so like over here, it says SDH area command is activated, and you can go and view the org chart. It gives you an opportunity to kind of click on where the action's happening if you want to go ahead and do that. So we're going to spend the rest of our time now going through a number of these tabs that are up on the top of the page. So the first tab that we're going to go through is the ICS chart. And as you can see, we've restructured the SDHCC coalition command to be a neater, cleaner look. We're currently still in the process of doing that. But as you can see, we've got it broken down into chapters. We have a space for our clinical advisor. We have a space for our health system corporate commands. We have a space for the RDHRS system. The RDHRS system is a federal project that will have patient relay and coordination groups in each of the regions. So region 8 will be Mountain Plains. And as they continue to grow, and there's only 2 in the country right now, but as they continue to grow, we will continue to add our partners from RDHRS. We have Department of Health Command, and then the typical area command positions for the coalition itself. And then we are growing out our subject matter expert group to include our EMS advisory, information technology, and other SMEs, and then state, county emergency managers. As you know, in incident command under NIMS, we are an area command, so we do not use an operations section at all. So we put that to sleep. So what do we need to do here? When you log in, the first thing that you need to do is find your position in your chapter. And so for me, I will be the area commander. So we need to highlight, you need to go and you need to highlight your position. So I'm going to highlight my position, and then down over on the right-hand side, there's a couple of what they call drawers, and you're going to go to the response tracker and assign contact. And click on that. Now, as we continue to grow this out, we're going to have people who are involved and who are preordained to be in different locations and different assignments. So Kevin and I are both area commanders. So I'm going to find myself, and I know that I've already responded, and I know that I'm available. So I'm going to click on my name, and it's going to give me an option to assign over here on the bottom. Sometimes a box will pop up to update your contact info, but I'm going to go ahead and assign, and a box will come up and say, should I assign Greg to the area command? And I'm going to hit yes, but I don't want to send myself a voice notification because I'm assigning myself. and it's just waste a phone call that's going to, ring in your command center. So I'm going to hit yes. And what you're going to see is two different areas are going to have action. Down here, it's going to tell you that I was assigned, and up here, you're going to see my name pop in there. Okay, so as my name pops in, I will get a notification on my screen because I'm logged in as myself that I've been assigned, and I do not want to update my information. So there, I just got a text message from eICS telling me that I have been assigned the area commander on my phone. And if I had the if I was signed into the eICS app, I would have also gotten a message from the app. So for you guys that are playing along and logged in, you can find yourself under the chapters. Okay, so you'll see here that there's Black Hills chapter, and it's broken down into clinics, hospitals, and long-term care, and then the regional coordinators. So each chapter will have up here a chapter co-chair or chair who might be serving as the liaison from the chapter to the area command will be in there. A lot of times that'll be blank because the chair or co-chair will be in their facility, but you really need to go ahead and look and find your facility and then log somebody in. And if you see down here under Avera St. Luke's, Candy Perry is logged in. And why is this important? And under Battle, Hope is logged in. Why is this important? It's important for us for a couple of reasons. Number one, as an area command, we need to know as we start communicating during a large scale event, which hospitals are actually logged into the system, and B, who our contacts are at those locations. So if I click on Hope's info, it'll bring up all her info if I need to get in touch with her on how to communicate with Hope directly. Okay, so if we have questions for Battle Healthcare Center and we want to talk to Hope, we can just click on the name and get all that information. Same thing with Candy Perry and Kevin and whoever else is logged into this system. So the other thing is, as we start looking through these events, and let's just use a scenario of multiple tornadoes touching down, and we've sent out a statewide alert for people to know to log in and communicate. We want to see that if there are any facilities that are actually in the path of the tornadoes that we're seeing on the National Weather Service radar, that they are actually functional and not damaged. So if we see facilities that are not logged in, we will reach out to those facilities and find out that they are functional and ask them to please have a liaison logged in to the area command. So so that's basically how you log in to the area command, and you're going to see some minor changes as we go along in the structure of the area command, but your locations where your facilities are have not changed. We've just neatened it up a little bit. So if you're Sioux Empire, let's say you're Vermilion and Sioux Empire, you click Sioux Empire chapter, you go to Coalition Hospitals, and you go, and there you are, Sanford Vermilion Medical Center. So it's, you have to know your region, you have to know, where you are in the system. But for the most part, it's pretty much easy to follow. All right. So, so once you're in the ICS chart, you're pretty much good to go, and you're able to see who else is out there responding to this particular incident. So again, if there's any questions, please type them into the chat box as I'm speaking, because we're going to move on now and talk a little bit about the event log. Now, the most important thing you need to realize about the event log is that the event log is not actively monitored by area command. The way area command works is we are going to be monitoring either the ICS chart or the objectives screen, which we'll get to. And if we're using a EM track in any of the exercises, our other screen, we have several screens at command. Our one main screen will be eICS and looking at the objectives board. Our second screen will be EM track looking at the patient status board. The third screen we have will be our WebEx. And then we have several computer screens that we may be able to look at other items. But what we really are going to be doing here is monitoring the events and not this. So basically what the event log is this is a database, and the event log is a table that holds everything that has occurred throughout the event. Now, you can use the event log to do situation updates. You can use the event log. Now, mostly we'll be doing situation updates in the event log. But again, most of the situation updates are going to occur on the WebEx live, so we can interact back and forth better. But here's an example of a good way to use the event log. If you're in your command center and you're having a discussion about how something can work better for the coalition, or what we could do in eICS to make the information sharing more effective, you can go in and put an area for improvement in here. Or you can put in a major event like tornado just hit us, or a strength that you've identified, and these all become part of the after action. But let's just say you want to put in an area for improvement. So you know the action buttons are always usually on the bottom right of either the big screen on the right or the little screen on the left. New log entry, you're going to go to area for improvement, and description. Please send radio frequency to all sites at login. All right, so, and what that means is, after our last exercise, I had a conversation, our communications exercise, I had a conversation with Caitlin Thomas, and we said, you know, we may not all be able to speak on the same frequency at once. So we had a conversation about using DOH-BT1, just DOH, not region 1, but BT1 as the landing frequency for us to communicate, and then separating out if we have to. And that's a discussion that Kevin and I'll have with the state partners as we move on. But just as an area for improvement, we'll be adding radio frequency, what radio frequency we're on, to that landing page, and hit save and close. Now I want to prompt you, as you're having these conversations in your command center and you come up with good ideas, if you have time, go to the log entry and add that, because you know, an hour later you might be so distracted that you forgot you even had that conversation about the log entry. You can also go in and read, if you've come into an event late, you can go in and you can filter all of the different things that are collected here in the event log. So for example, what if you wanted to just look at situational updates? So unselect everything, click on situational updates, hit save, see if there's any situational updates. And Kevin's put a message in there saying, you know, we've a new branding for the SDHCC command. You can go ahead and you can look at just areas for improvement, and you'll see the update that I put in. So a couple of people have put some areas for improvement in there as well. And there's one in here, continue with Javari education sessions periodically. And Kevin and I have had some conversations about this, and I had a long conversation with Melanie yesterday. We're going to revive, like when we do the interregional every other month, on off months, we're going to do a communications drill and a training where we'll be able to come in and go through Javari. So we're going to do something monthly with this rather than every 6 months, so people can jump in. You'll be mandated to do it every 6 months, but we're gonna start opening up a communications exercise on off months of the interregional. So just so people stay more in tune to it. So anyway, inside the event log, there's just a lot that you can see. It's not really the real active stuff that's going on though. So we want you to know about it. We want you to be able to share your information in here, but we really are not going to be focusing on that in our command center, in our area command. And I'll show you why in a little bit, because the objectives and messaging is the most important piece. We're going to move over to the file section. There's some things you need to know about the file section. So the first thing that I did this morning was I uploaded the eICS task list. So the eICS task list has been updated to match some of the new format. And I was going to email it out this morning. I emailed it out the other day. I was going to email it out this morning again, but I had an email crash, and it took about an hour and a half to get my email back up with the vendor. So I have uploaded it here to the files section. Now I'm going to teach you how to download files and how to upload files to the files section. One of the things we're going to do for the exercise next week is we're going to have you download a roster sheet that you can fill out and upload back to us, so we have a record of who attended your exercise in your command center. Okay, so I'm just going to use the eICS task list as kind of the dummy file for now, because you're going to download a roster file next week. It'll have directions on how to rename it. You're going to fill in the blanks of the people who attended. You're going to rename it to your facility, and you're going to upload it. So I'm going to show you how to download a document and how to upload a document. So the first thing you're going to do is you need to find the document you want to download and click on it. That'll bring up an action window over on the right. Now, this is very important, so pay attention. Do not ever, ever, ever click check out, okay? Make believe that button doesn't exist, because if you hit the checkout button, you will remove that document from the view of everybody else throughout the state, because it works like SharePoint. Once you check out a document, no one else can have access to it. So what you're going to do is you're going to click download to view. So you have the document highlighted, you click download to view. You'll see I'm using Google Chrome, and you'll see in Google Chrome, it has downloaded that eICS task list to the bottom of my browser. I can simply drag it off of my browser onto my desktop, and be good. And it's also left a copy for everybody else. So once I download that and drag it to my desktop, I'll open it up. I'll do the appropriate editing. And then I'm ready to load it back up into eICS. So what I'm going to do here is I'm going to show you how to add a file. With one more note, please never, ever, 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 ever click checkout when you're downloading a file. It happens all the time, and it happened during the training yesterday. So please do not do that. It's very important that you click download to view. All right, back to, let's add a file. So you've filled out your document, or you want to upload a document for one reason or another. You click add file, and then you have a couple of things. You can have a facility library in eICS, which we haven't really started using yet, but we will, or right from your desktop or your local drive, and you have to go look for it. So I'm going to upload a file from my local drive. I'm going to hit browse, and I'm going to look for the document version of the eICS task list. And I'm going to find the file that I want to upload. And I'm going to put it in there with everything looking good. I'm going to go ahead and click OK. And what you'll see is now the Word document version of the eICS task list will now appear in the screen on the left. So when you rename something, you'll see what Kevin did is he uploaded a document called Control 2 eICS training file. And we know that Control 2 is Kevin because he's logged in as Control 2 here in eICS. So we know who's uploaded that file. So as the file section begins to populate, it's very important that you rename those files with the name of your facility. And so it would be like Bowdle Healthcare Center _ participant roster. So you just want to prefix it with whoever you are. So we know when we download and put it in our records what facility that is. So the files section is relatively easy to download and upload files. We'll have pertinent files in there and so on for you as we go through. The eICS task list will always be there. Contact information for the command center and the different email addresses that'll be associated with the command center will also be up there, and also on the front page of that. So as we continue to set up for the exercise next week, I'm really chopping out parts of the office to be different parts of the area command, and it's working out rather well. So you might even see a map in there, but more importantly, you'll have the contact info for the patient tracking. You'll have contact info for planning and policy. You'll have contact info for cash managers and the PIO. So there's a lot of stuff that we're going to put up here for you to download. The rest of the time, mostly we're going to spend on these next two tabs. So when you open up the eICS task list, you're going to see a little notation, and it's going to say when objectives mean you need something. So when you need something from the coalition, you'll set an objective. When you want to tell something to the command, and it's just a matter of wanting to tell something to us without a request, you're going to send us a message. It's like a text, just like sending someone a text message. Okay. So I need to be clear now that when we launch the area command for the coalition, there is an expectation that each facility that gets a notification will launch their own version of eICS, managing the event in their own facility. So we are not setting objectives and assigning people to run eICS for your facility in the SDHCC command. It is an area command, which means that we will provide you with overall information. We are a clearinghouse for communications between facilities, the State Department of Health, and our partners, but you shouldn't be putting local objectives into the system. You should be using your own version, and everybody has their own facility in eICS, and you should be using that to manage the event that is and how it's impacting you locally. So when do you set an objective for the SDHCC, for the coalition? It's when you've exhausted all of your local resources and you can't get something from your local response, and then you need to activate the coalition for something. So let's just do something really simple. And let's just say that there's a water outage, or there's a series of tornadoes that have created a water outage in Webster, South Dakota. Okay. So if I'm in Webster, South Dakota, I'm going to click new objectives. Remember, I always said the action buttons are always on the bottom of the left or the bottom of the right. So your action button here is new objective. When you click this, action window will come up. Okay. So the objective should always be prefixed by who you are. So we'll just say Sanford Webster. And then what you need. Very simple in the objective, facility name and who you need. If you don't put your facility name in there and there's no other identifiers, we need to dig and try to figure out who posted that. So this is going to come up nice and neat in the objective side. So we have no water, need water, and always initially assign it to the area commander, because that's the position that will always be there. So I'm going to go ahead and click save, and you're going to see the Sanford Webster need bottled water. So as you see, we know who the facility is, and Bowdle has put a water thing in there as well. So it says Sanford Webster need bottled water. Now I have gotten email, text messaging telling me that there are new updates and objectives being sent to me. So on my phone, it's going off telling me that, there's some information coming in. All right, so let's look at this. So now I'm sitting in the area command, and I've got highlighted Sanford Webster. So if I highlight Sanford Webster, it's going to give me some information. All right, so let's just say I go ahead and I get a hold of another facility. Let's say we call Aberdeen, and Aberdeen is able to get them bottled water. So I'm going to go ahead and click update. And you'll see that doesn't really give you a lot of information here. So I'll always click show more details. And so a couple of things will happen here now. I'm going to start the status and say that we are looking at it. So in progress, normal. And then I'm going to put a comment in there. Spoke with Sanford Aberdeen, and they will send to you ETA 60 minutes. Okay, so now you've got 60 minutes. Now you're going to see a couple of things occur. You're going to see an update occur down on the bottom. You're going to see this dot turn green, and you're going to see a comment appear here, which is the most recent comment. So now the dot turns green, the comment appears, the objective update appears down over here. So these are all of the things, and you'll see who last updated it. So you know that Greg Santa Maria, who's the area commander, because you can go back to the ICS chart and see that, you know that without even calling or texting, that the dot turned green, area command has gotten your message. There's a comment in there. You can move over to it and see, all right, Sanford Aberdeen, and they will send it to you ETA 60-minute. Now, the other thing that I can do here is in the update, I can move the assignment to Sanford Aberdeen and just assign it to them. And now it'll disappear from here. But let's just say in our command, we're going to select all positions so we can watch all of the different we can watch all of the different activity. So we know that this is assigned to Sanford Aberdeen now just by looking at it. Now, what happens if I want to go through some of the colors? What happens if Sanford Aberdeen? So red means there's an objective that has not been dealt with yet. Green means it's in progress. So what if something slows things down? So Aberdeen turns around and says, wow, we called our vendor, or our vendor called back and said they have a 4-hour delay, they can't get it. So all right, so 4-hour delay. So we're going to make a comment. New ETA is 4 hours from 11:30 is 3:30. So they're not going to have water till 15:30 hours. So the next thing that happens is in progress with an exception. So now you're going to see a couple things happen here. You're going to see the comment change. You're going to see the color turn to yellow and a new update over here on the bottom. I'm going to click. You'll see the update. You'll see the color with an exclamation point, and you'll see 4-hour delay on delivery. New ETA is 15:30 hours. Okay. And as things go on and on, this is what you're looking at here is you're starting to develop an event history for this particular objective. But in this screen, you can only see the most recent comment. But if you want to go down and you want to look at the event history, just go down to history, click on the history box, and you'll see from the minute the objective was created to now, all of the different communications that have occurred based on this objective. And this is important if we go into 12-hour ops periods or something where a new commander comes in, can kind of go through the screen and say, all right, this objective has been open since 11:30 in the morning. It's now 8 o'clock at night, and we're still going on this. Let me check on what's happening here. Now, rule of thumb that we have created across our coalition and across the state is only the facility that has started the objective can close the objective. So the objective is enclosed because I've gotten water for Webster, or I've gotten a promise of water for Webster. The objective closes when the water physically arrives at Webster. Okay, so when Webster gets their water, they can go into update. They can go and they can put a note, water received, and then go to status, and then go completed. And then you'll see that turns into a checkbox. Another thing that is potential here. So let's just go to Bowdle and let's say, and so we have the same kind of request for Bowdle. So now I'm going to go in and say, what kind of water, let's say, well, what kind of water do they want? And so on. So I'm going to put a question in there. Can you elaborate on your situation and advise what kind of water you need? So is it potable water or non-potable water, and container sizes? Let's just make that up. And I'm going to go ahead and put other. Now, other in our world turns it blue, which means there's a question. So when Hope is looking over here, she's going to see her little dot turn blue, and she's going to now go into the comments section and see the question. So area command is asking a question. This was last updated by me. And Hope will go in and read that and say whatever it is that she's going to say. Once she does that and makes the change, she'll turn that dot to green, that identifying that, that there is action happening in that particular objective. The other thing that we can do here, and I'm going to put some, I know there's a way to put some identifiers in here like checks and question marks and things, and I'll do that. The other thing that we can do here is order them by not started first. So it'll give us, this one's not started. We brings all the red dots to the top. And then the other thing is that we don't really need to look at what's completed. They're done. We'll click OK and it'll erase that. So only the active objectives will stay active in the system. So that's something that's important in a sense of, the communications piece, because it gets really wonky after a while if you have all these completed objectives intermingled with others. Now you'll see that the other thing that happened here is that Hope created a high priority event, and we have it ordered by not started first, but we can also order it by the highest priority, and then it'll reorder them based on priority. So and how to set the priority is over here. When you go to other, there'll be an option to set your priority to high, medium, or low. And that'll help you in the ordering. Please just don't set every objective to high, because it kind of takes away the whole idea of that. And normally the prioritization occurs at the level of the area command. Okay, so now Hope has responded and says, I need distilled water. So I'm going to now say, thanks, and we're on it. Update to follow, and I'm going to turn her dot green so she knows that her question's been answered and that we're working on it. And you'll see again, my answer is there. But if you go into the history, you'll see the whole conversation on that particular objective. So all the data is there for everybody to look at. So let's just say Hope's incident commander changes again, and they're like, oh, look, we still need water. They're working on it. Let's see what's going on. And they'll be able to see all of the data here. And this is really important to be able to follow an objective from start to finish. So now Hope got the water because it just disappeared off our screen. But I guarantee you, if I go in and I say, show me all the completed statuses, you'll see that the water status has been updated and completed, and she checked it off. So so that worked out really well. So so this is how you manage the objective section. And again, the objective section for the SDHCC command is for when you can't get something done locally. So for the facilities that are, for the drill next week, we're going to ask you to run through this task list and set objectives in there. There's going to be, there's always some facilities that are not going to be utilized. We're going to be doing some decompression in the exercise as well. But we're going to try and communicate with you. We're also going to require you to do your THAM tool and do your risk assessment as a mandatory for this exercise. And the THAM will be up in the file section as well. So anyway, that is how you submit an objective and how you communicate through the objective panel. And that is what we will be watching in the command on one of our big screens all throughout the entire event, as we'll continue to watch the objectives and so on. The next panel, or the next tab, is our messaging tab. And our messaging tab is, when you want to just tell us something, or communicate back and forth without identifying a need. All needs need to be identified through objectives. Messaging might just be, a heads up, or just a message. So I'm going to send a message to Kevin stating that, hey, listen, we're a little shorthanded in the command. Is there any way you could come over here and help us out for an hour or two? Okay, so let me go ahead and find Kevin. And I know that he is control 2. So I'm going to do a search for control 2, and you'll see when you put your search in, you'll see that the active positions are bolded, and you'll see the name of the person who is managing that position. So I'm going to go ahead and click, and this message will go only to Kevin. There is also a possibility to send to all candidates and all assigned positions, and that happens way too often, where people send a message to everybody and then go ahead and click send email and send text. And what that does is it literally email everybody that's been activated for the incidents, and we do a statewide exercise. We activate, a couple hundred people. So if you hit all candidates, send email, send text, anyone that's been notified and in the system is going to get an email and a text. And that happens more frequently than not. So if you have a message, you want to send a message just to Kevin or area command. So let's just show you that. So you type in SDHCC command. SDHCC area command, you'll see that's me, and you want to send a message to the area command. And so let's just say you want to send a message, and again, messages start with who we are. So we'll say Vermillion. Hearing we may lose power in a few minutes, may go offline. Hearing we may, or let me just shorten that. Vermillion, power loss. Hearing we may lose power in a few minutes. Use cell 605-111-1111 to contact. If we get disconnected from eICS, okay? And now I'm gonna hit send, and that will pop up. So again, who and what. All right, and then when we go in, I just got a text. Hearing we may lose power in a few minutes. I will add a response. Thank you. We will monitor. Okay, and then that's it. So you'll see that there's been messaging in here, and you're tracking it. And the other thing that you can do with a message is prioritize a message, like a new message. So let's start a new message and say the same thing. So let's find SDHCC area command and search, and we're going to find, I don't know why it does that. We'll find me again. Subject Vermillion. Fire. We have a fire in our boiler room. Okay, and then you go high priority. So I want you to notice along the bottom here, just watch this bottom bar as I move the high priority message into play here. Well, it didn't do it. The bottom bar usually lights up red and says there's priority messages waiting. So I'm wondering why it's not doing that. But a lot of times when there's a priority message, it will, there it is. Okay. Oh, it's because I was in the messages. So if I go out of messages, you'll see the bottom bar light up. So there's this bottom bar, and it's lit up in gold or yellow, and it's showing me that there's messages. But when it lights up in red in the corner, that means that there's a priority message waiting. Okay, so when you're in messages, it doesn't show you the message queue because you can see it here. When you're out of messages, you'll see the message queue. So I can go in and go ahead and click and kind of look at the unread messages there, or I can go into messages and see this high priority message. So again, messaging is utilized like text messaging to send messages back and forth from facility to facility, to communicate non-need items, updates, things like this that we just showed you. So here's one. If you need further supplies, let me know. Here's one. My radio doesn't work, and so on. And we can coordinate by connecting. So Hope's radio is not working. We can coordinate by connecting her with Chuck, and moving forward. So remember, when you're doing objectives versus messaging, it's always, I need something, I want to tell you something. I need something, I want to tell you something, and kind of go from there. The next, again, questions, put them in the chat box. The next, we're going to do just 2 more tabs. The next tab is contacts. So the contacts tab is all of the people who are active in the system. So people who are logged in. Now, when you're in the drill, you're going to see way more people in here. But what's interesting about the contacts is that you can see contacts, you can see candidates, you can see facility contacts here by expanding another one. So we have 950 facility contacts in our system. So you see we went from 6 over here, view 1 to 6 of 6. When I go to facility contacts, we have 950 contacts. And if you go to health system contacts, it stays the same. So because our facility and our health systems are the same, but so if you were in Sanford or Rivera, you'd have your facility would have candidates would be people who are active in the system. Facility is everybody who's in your facility, and health system is everyone in your health system. So the numbers, continually escalate when you click to the right. So if you can't find somebody here, sign them over here and you need them, you go ahead and click enlist to ICS. Now, another thing you can do is, let's say you want to have your emergency manager. Let's say your emergency manager is going to get you, 25 cases of bottled water. You can add your emergency manager in, and they'll get an email, and they'll be able to from there, wherever they are at, participate in this. So a login email, let's just say em@vermilion.com. First name is EM, last name is Guy, organization Vermilion EM. Okay, and then so what you're doing here is you're adding this person to your event, 2-hour event. You're enlisting them in the incident automatically, so they'll get an email saying that, here, click here and come into the event, or not. And then you click OK, and it'll put them in there. I'm not going to do it because we finally cleaned out all of the test people, but that's how you do it. So you can, and one note on this is, when you add people on the fly in an open event, it only adds them to the event. So if you want your emergency manager in your facility launches, or your fire chief or your MS person, you need to do that on the planning side of eICS. And after the exercise, we're going to do a 3-hour admin training, a couple of 3-hour admin trainings to show you how to run the back end of eICS, how to set it up, how to do IRGs, how to set up call trees, and so on. But this is how you bring somebody in to an event on the fly. And as soon as you do that, again, it'll bring them in, but it doesn't keep them in there for forever. When the event closes, that person falls off of that. So that's how you manage your contacts list. And then the last thing that we're going to talk about is the map feature. So the map feature is used really to identify locations and locations of your facility. So, our command center is someone's in Minneapolis, in Minneapolis on a boat, but our command center is located in Sioux Falls. So we always ask people to go ahead and place yourself on the map, and that way we have a 10,000-foot view of what facilities are up and running. This comes in handy specifically for activations for severe weather, where we can really overlay a weather map on our facilities and look at our facilities for issues. So I'm going to go and add a new location here, and I'm going to call it SDHCC Area Command. Stay consistent. description, SDHCC Command Center. Icon, and Javari still doesn't have an icon for a command center. So we'll try to find the closest thing that we can use, and let's use a flag for our command center. Now we're going to put our address, which is 310 West 18th Street in Sioux Falls, South Dakota 57104. And then once the address is in, you click the down arrow and it'll pop those GPS coordinates in, and it'll set that flag, and you hit add. So a couple of things, a location type is building. Okay, so then we click OK. So now as we hover over these different icons and click on them, we can see who that is and get a little bit more information on each and every one of these. So, let's go look at the boat. So Kevin's on a boat in Minneapolis, and he's over here on this Nokomis River, it looks like, or Nokomis Lake, having a good time. And you'll see the command center as well. So when you pop this in, you'll see the command center info. And in here, during the drill, we'll have email address for command, as well as the direct phone number for the command center. So as we build out our map, when we have 30, 40, 50 locations, you'll start seeing those locations popping into the map. And it's really helpful for us to see how many facilities are located here in our domain. And as we get closer into an active event, you'll see that we can zoom in on a specific area. This uses Google Maps, and kind of go ahead and see if there's facilities that are active that are hidden underneath the original icon. But you can see over here also that that if you click over on the left-hand side, it'll give you the information boxes on the map, like, hey, where's my name and Spearfish? They're all the way over here. They're logged in. Let's get some information from them, and this is where they're at, and so on. So it's very helpful to do the map piece as well. So so that's kind of it in a nutshell. It's kind of how to zip through incident command using eICS. And when you go through all of these different things and you go through these windows, you'll be able to see all different kinds of things that have occurred within there. So in the drill or in a live activation, you will see all of this lit up, and all of the different facilities will be, this will be open, and all of the different facilities will be active, and we'll see the names in there and so on as we run through the event. And the other thing that we can do from an event perspective is if we don't have somebody in there, we can certainly add them in on the fly as subordinates of a certain chapter or whatever. We'll do that when we get into the exercise itself. So I'm going to open up. We've got about 5 minutes. I'm going to open up for questions in the chat box. Again, I'm going to put, for those of you who joined late, if you need a login or you have any issues, it's info@southdakotahcc.org. Please note we're dealing with an email exchange transition today, so our email will be up and down all day, but we will get back around to you and get that in. Now, the other thing that I will make clear is that if you need to add people to your own domains, that's on whoever your person's admin is for eICS. So we don't manage the domains for the facilities. We only manage the domain for the area command and the SDHCC area command. So you'll have to, if you need to add people in for your drills, this is the time to do it. Go into your own eICS facilities and kind of look and see, what you've got there. So I'm just going to look, you know, and see if there's any contacts for Black Hills Surgical Hospital, and so on. And we don't have any contacts listed in there because we didn't launch to all of these people. So, you know, this is the time, a couple of days before the drill, to kind of go into your own events, see if you can launch your own events, and make sure your call lists are up to date. And if you have any questions, but if you don't have access or you need an account, so you can do that, send a message to info@southdakotahcc.org, including your first and last name, the email address you want, your cell phone number, as well as your cell phone carrier. So we can add that in and create an account for you. Once we create the account, you'll get an email from Javare that'll tell you account has been created. Please go in and update a password. So that is all I have for this particular training. I am going to stop sharing, and I'm going to also stop recording.